Good afternoon, buon pomeriggio. This afternoon we will have two simultaneous surgeries from the operating room, an ACL double bundle by Dr. Pederzini and Dr. Xavier Cassard from Toulouse, France. Due interventi oggi, andiamo di sala a sala, quando sono pronti i chirurghi iniziamo il meeting. Prima di iniziare con la parte operatoria, before starting the operative session, I'd like to invite Dr. Ivan Saenz from Barcelona to come and present on the anatomy of the anterior cruciate ligament.
Thank you very much. First of all, I would like to thank the Rico Gervasi's invitation to participate at this meeting.
Stendi un po' di più.
I will make a brief introduction to the anatomy of the different regions, which later will be performed like surgery. So the surgery that follows is on the anterior cruciate ligament. We will know the anatomy of this ligament and its two bundles.
Fede che fa fixa il vecchio e il nuovo.
It's very difficult to summarize the anterior cruciate ligament anatomy in a few minutes, but I will focus on that, especially explaining their origins and their attachments. In this anterior view, we see as the ligament presents different bundles from each origin, and we can see the relationships between the origin of the anterior cruciate ligament with the anterior horn of the lateral meniscus. In this sagittal section of the femur, with the knee extended, we can differentiate two bundles. Both are directed towards to the medial side of the lateral condyle. The anteromedial bundle, more relaxed in extension of the knee, goes to the upper region of the ligament insertion. The posterolateral bundle is tenser than the anterior with the knee in extension and backwards to the insertion into the condyle. These fibers are larger, more resistant, and thicker than the other ones. Some authors have described an intermediate bundle, but we have never seen in all dissection this fascicle, this bundle. The tibial origin of the anterior cruciate ligament leaves a footprint into the tibia bone in the anteromedial intercondylar area. This footprint is divided in two parts, one of each for the ligament bundles, one anterior for the anteromedial bundle, and a posterior for the posterolateral bundle. This tibial footprint was described by Edwards. Its measurements were 9 millimeters in the mediolateral diameter, approximately, and 80 millimeters posterior-anterior diameter. And Edwards studied 29 tibial plateaus, and he described the shape of each one. In the femur attachment of the anterior cruciate ligament leaves an oval footprint. This oval footprint is situated on the top of the medial side of the lateral condyle. When we are working with the arthroscopy and the knee is flexed, his shape slightly changes. The top belongs the anterior medial bundle, and the bottom belongs to the posterolateral bundle. To conclude, Edwards also studied this femoral footprint, his shape and his measurements. Its width was about 7 millimeters, and his height was about 14 millimeters. Thank you very much.